Let's talk about a topic that can feel a bit serious but is incredibly important: cancer screening. While it might bring up some anxieties, understanding and utilizing recommended screenings is one of the most powerful tools we have for early detection, and early detection truly can save lives. So, what exactly do we mean by early detection? It means finding cancer at an early stage, often before symptoms even appear. Why is this so crucial? Because when cancer is detected early, it's often smaller, hasn't spread as much, and is generally easier to treat successfully. This can lead to better outcomes, less intensive treatments, and improved quality of life. Let's dive into some of the most common and recommended cancer screenings. Please remember, these are general guidelines, and it's always best to discuss your personal risk factors and screening schedule with your healthcare provider. Colorectal cancer affects the colon or rectum. Screening for this cancer typically begins around age 45 for individuals at average risk. Common screening methods include colonoscopy, which allows a doctor to view the entire colon and remove polyps that can be precancerous, and stool-based tests, which are non-invasive and look for blood or DNA changes in your stool that could indicate cancer. Regular screening is really vital because colorectal cancer often develops from polyps over many years, giving us a window for early intervention. For women, breast cancer screening is a cornerstone of early detection. The primary screening tool is the mammogram. Mammograms are X-ray images of the breast. For women at average risk, annual mammograms typically start at age 40 or 45, depending on specific guidelines and personal preference, and continue as advised by a doctor. Clinical breast exams and self-awareness are also important. Early detection of breast cancer through mammography can lead to less aggressive treatment options and honestly a higher chance of survival. Cervical cancer screening is crucial for women's health. The main tests are the PAP test, also known as the PAP smear, which looks for abnormal cells on the cervix that could lead to cancer, and the HPV test, which checks for the human papillomavirus that can cause cervical cancer. For most women, screening usually starts around age 21, with regular tests every few years depending on age and test results. These screenings have, dramatically reduced cervical cancer rates. Lung cancer screening is recommended for specific high-risk individuals, not the general population. It's primarily for current or former heavy smokers who meet certain age and smoking history criteria. The recommended screening method is a low-dose CT scan of the chest. If you have a significant smoking history, you should talk to your doctor to see if you qualify for this important screening. For men, prostate cancer screening often involves a discussion with your doctor. Methods include the PSA blood test, which measures prostate-specific antigen in the blood, and the digital rectal exam, a physical examination of the prostate. The decision to screen is individualized, often starting around age 50 or earlier for those with higher risk factors like family history. It's essential to have a conversation with your doctor about the benefits and potential risks of screening based on your personal circumstances. Beyond these specific cancers, here are some general principles to keep in mind. First, know your family history. Share your family's health history with your doctor, as it can significantly impact your recommended screening schedule. Second, discuss with your doctor. This is honestly the most important takeaway. Your healthcare provider is your best resource for determining which screenings are right for you, based on your age, gender, risk factors, and overall health. Also, don't ignore symptoms. While screening looks for cancer before symptoms appear, always report any unusual or persistent changes in your body to your doctor. And finally, healthy lifestyle. Remember, screenings are a vital part of prevention, but maintaining a healthy lifestyle by eating well, staying active, avoiding smoking, and limiting alcohol also plays a huge role in reducing your cancer risk. Cancer screening is a powerful act of self-care. It's about being proactive, staying informed, and working with your healthcare team to protect your health. Early detection truly makes a difference, offering hope and better outcomes. If you haven't discussed your cancer screening schedule with your doctor recently, make an appointment to do so. It's a conversation that could save your life. Thank you for watching. If you found this information helpful, please share it. Stay informed, stay healthy,